Professionals Network is a group that allows health professionals, all health professionals in the region, to communicate, to receive education and to network socially in different ways, informally and formally. Allows people to get together and collaborate and work together towards achieving the best possible health outcomes for the Pilbara.
What I think is really needed is a networking opportunity where people can come in, talk to other professionals, interact, discuss and learn about their colleagues which may not be from the same profession. And that way, that interprofessional interaction will actually help with the management of patients and also balance out some of the uniquenesses of working in a remote area like the Pilbara.
With having a network, I think when you do approach non-traditional circumstances health-wise, you have a group of health professionals to have a conversation with and ask them what's your take on things, and to be able to, I guess, give the best healthcare outcome that you can for the patient.
We're just about to start a student in Karratha, and I'm having one here, we're having one here. And to be able to link them into professional people both in the towns and outside of in the other towns, I think that's going to be really important.
The aspects of health do require that multidisciplinary approach, so to have that network there best to support the town members is really important. I think something that's really cohesive and agile for the person's needs.
Well, we always like to be collaborative, but the best collaboration's when you know the person that you're going to be working and co-managing with, as well as we can sort of instill greater trust that sort of we know who we're working with, we've met them, we've sat with them, we've chatted with them. I think that speaks volumes for confidence for ourselves, but for patients too. But then obviously sort of the well-being collectively for the town and for the community, as well as sometimes just making aware of what resources are available that we mightn't have been aware of before, which is cool.
We've got our little scope of practice, but we acknowledge that there's lots of different health professionals out there that can help our patients. So being able to know the physio next door or know the good doctor that knows what he's talking about in terms of a certain condition and being able to refer someone to someone that we know and trust would be great.
It's so beneficial when you do know people and you have those contacts, being able to refer people on and do that effectively and get people the support they need. It makes a big difference. It's the difference between working in isolation or taking a holistic approach, and definitely that holistic approach is the thing that's going to make the difference.
It's been really positive in just knowing that there's support there. Like, you can feel like you've got a lot of weight on your shoulders, I guess, with clients, but just knowing that there are other services, there's other people out there. It's also just that as a professional, knowing there's other people out there that can support you and you can turn to, or you can refer clients to that might be better suited for them.
Obviously, with our very remote sites, it's very difficult for our staff to leave and access training opportunities. So hopefully this network will help support those workers to access some of those opportunities and look at, I guess, economy of scale as well, where there might be a broad need amongst a range of services for the same training. How can we access that?
So supporting rural allied health clinicians such as training, education, relocation assistance. This is another network opportunity that I think would be great benefit to those allied health clinicians in regional WA.
Yes, so we're recruiting all new staff. We're setting up a new clinic completely. So retaining staff, there are many factors which you have to put in place. One of them is around professional support and the networks, staff development and training. So I think that will really be good. So if people, who have to stay in the region, they need that support.
It's really daunting when you move and you're so far away from your support networks, your friends, your family, and it can be quite isolating if you don't have those connections. And I guess a place that you can go, or a network that you can be inducted into really early on, would give people that confidence and make them feel at home straight away.
So I think this health professionals network could really help support local Aboriginal staff, and that's not just Aboriginal health practitioners, but any of our Aboriginal staff.
in places like this, people can become a little bit insular, and the community is what the main draw card is here. So by linking in everyone together, we're going to bring that community feel to the health network as well.
I think the health professional network is going to be great for people, especially coming into Newman. They already have that professional relationship with allied health or other nurses already, and it's going to be a lot easier having those professional relationships. Coming in, you'll be able to make referrals a lot easier, and that's going to help the client-centred care a lot more as well.
So I think the Health Professional Network will be a really good opportunity for local service providers to have a really good understanding of what each other can bring to the table. I think it's really important to create those professional networks so we can all support each other in a regional location, and but also be able to provide services cohesively for the clients that we're seeing, learn how to make referrals to each other and what we can all offer, and support each other professionally in terms of our knowledge and learning.